Hello, everyone. My name is Levonti Ohanisian, and it is my honor and privilege to present this topic for you today. It is called What Being Armenian Means in the Day and Age of Diversity Awareness. It's been a topic that I've thought about for some time. It's been nearly a decade now. And I'd like to take you through the evolution of my thought and my experiences as to how I came to discuss this. And I think that story itself will provide a lot of context as to what it means to be an Armenian in today's day and age of diversity awareness. I'd like to just say that I don't think I'm alone, and it's the reason why I decided to talk about this. Many Armenians I've met along the way, particularly Armenians in medicine, have had similar stories. And when I described having a talk like this, I was met with incredible enthusiasm. My hope is to put some words to that sentiment today. So, to stay in compliance with the Armenian American Medical Society and the organization, here are the disclosures that I'll briefly pause to let everybody read. And to stay in accordance with the other presentation, this is my biography that you can take a moment to read if you'd like. I will certainly tell you a little bit more about myself as it pertains to how I got to this topic. And so I'd like to begin describing this, what being Armenian means in the day and age of diversity awareness. Like I said, it's been a long time since I've wanted to give a discussion like this. I just didn't know how and where and which forum. But this is absolutely the perfect place to give this talk, in my opinion, because I think it can cultivate a lot of discussion, and I'm really looking forward to that. But I really didn't feel empowered as a diverse contributor to society, and that's really where this was born. And diversity is undoubtedly a positive thing. However, there's no currently accurate way to ensure Armenian inclusion in diversity in medicine. And so that was some of how this talk was born. I have no personal disclosures other than the fact that these are my opinions and my stories. So let's start with diversity, a very important word, particularly being an Armenian American. We're a melting pot in this country, an amalgam of people and cultures. So this word has been thrown around a lot. Well, when you define it, it's the inclusion of people, different races, cultures, etc., in a group or organization. And this definition to me changed over time as an Armenian in America. And that's why I started thinking about this topic. But it doesn't take away from the fact that diversity itself is incredibly important. I'd like to discuss some of the literature that shows us that. This was a large review study out of Howard and FAU, published in the Journal of the National Medical Association, and cited many times. But it looks at diversity and its impacts on performance and outcomes. And it looks at many different studies among many different disciplines. And to go through all those studies in this talk would not do it justice. But I did want to highlight some aspects about this that demonstrate the importance of diversity and diverse teams. And you'd be surprised it's not just in healthcare. So in 2014, they discussed a meta-analysis that included 25 papers, and what they wanted to look at is increased diversity in healthcare teams. And what does that do? So when they had more diverse healthcare teams, things were better. More accurate diagnoses, increased patient satisfaction, increased compliance, and some evidence that there was a lower cost. But the important thing is it's not just in healthcare. So this shows us that diversity in healthcare teams can have an amazingly positive outcome. But they also looked in 2005 at Texas public schools. This was actually a longitudinal study of 2,500 Texas public school districts in the late 90s. And they looked at, okay, let's look at the bottom blue here. What happens when we improve diversity at the administrator and teacher level? Well, they looked at their student performances. And what we can see underneath is there was increased standardized sufficiency exam scores, increased SAT performance, and actually a decrease in dropout rates. So, diversity, even in schools with teachers and administrators, can have some significantly positive and profound impacts. It's not just in schools either. Why don't we look at the banking industry? In 2011, a paper was published looking at, well, let's take 74 US banking industry companies and let's see which boards have the most diversity and what happens when boards have more diversity. They were actually less risky. They were less likely to engage in excessive risk taking. And on a corporate level, again in 2015, a large meta analysis of 140 studies looked at board gender diversity. Okay, let's look at the blue again here on this slide. What happens when you have increased board level diversity? They showed increased profits and increased monitoring oversight. So it's not just in healthcare. Diversity is positive amongst many different disciplines, as we've seen in this review paper. So diversity is great. We've seen some evidence of that to start this talk. And I always felt like I could add to diversity. As a first generation Armenian American, I felt that I could impart to that contribution, but I never felt empowered to do so. And I really didn't feel like I had the opportunity to do so. And much of this talk will discuss why that is and how we as Armenians get lost in the shuffle and what we can do to certainly change that. Briefly, just about me, like I said, I'm a first generation Armenian. I was born at Glendale Adventist. Many people on the talk might be familiar with that hospital. And I was raised in Los Angeles. I got to do my undergraduate studies at Pepperdine University, which is not a bad place to be for 4 years. And I majored in sports medicine and I minored in French. Then I took my car and I drove from California all the way to Florida, where I got my medical degree at Florida Atlantic University in Boca Raton, Florida, a place near and dear to my heart. And currently, I'm in my final chief year as a resident at the University of South Florida in the orthopedic surgery department. Also, very happy to say that next year I'll complete an adult reconstruction fellowship at Stanford. But before all of this happened to me, I want to take everyone back to 2015. And this was the time that I applied to medical school. It was very competitive then, as it is extremely competitive today. So I sat down and I thought to myself, well, what makes me an attractive candidate? What would make me a good applicant? And as I pondered this question, I came to the realization that my diversity would make me a good candidate. Well, I am a first generation Armenian American. My family and ancestry went through much grief to get to this country. I went to an all French school my whole life, from first through 12th grade. Everything was in French, from chemistry to math to physics, you name it. And then I went to Greek school every Saturday growing up because my family went through Greece to get to this country. And so I thought my diversity is an attribute and I should certainly try to flaunt this. And I selected schools whose mission and vision statements strongly aligned with having a diverse matriculating medical school class. And don't get me wrong, there are many reasons why someone is not selected for an interview or admission into a medical college, and I completely recognize that. But I was surprised that none of those schools that I targeted who emphasized diversity offered me an interview. And that's when I started to feel this absence of empowerment as a diverse contributor to society. And I thought to myself, well, what does diversity really mean? I'm not the most diverse person, but certainly there was some diversity that could have contributed to a matriculating medical school class, I thought. And I really started to ask more questions about the definition of diversity, maybe the definition of diversity in the United States, because I just didn't feel empowered as a diverse healer and I didn't understand how healthcare viewed diversity. It wasn't that Merriam Webster's dictionary definition, let's just say that. And so the objectives of this talk is to discuss that in further detail, really talk about how we define diversity, and also to cultivate thought amongst a group of intellectuals that will be listening to this as to how we can have more representation, and feel more empowered. Because I think that could be the most important thing that could come from this talk, is everyone's opinion. Allow me to start and end this talk with the takeaway points. Takeaway point number one, we as Armenians have much to contribute as healers and diverse healers. However, takeaway point number two is our impact on diversity has been underestimated. And number three, it might be time to redefine diversity in medicine, or at least discuss how we define it and what mechanisms are in place. Let me quote one of my favorite authors, Adam Grant, also a psychologist, who says, diverse groups are more creative. They feel uncomfortable, and that discomfort motivates them to do extra preparation and share new information. I couldn't agree more. One of the statements that I've lived my entire life by is this one right here: comfort is the enemy of progress. And when you're in a diverse group, people from all sorts of backgrounds are bringing perspectives that you have never heard before. And it might make you a little uncomfortable, but that's how the best ideas are able to surface at the top. And that discomfort helps us progress. So, diversity in a group is absolutely critical. Cannot stress it enough. However, when you're filling out an application, maybe it's for a job, maybe it's for medical school, I know the list that I'm about to show in the next slide is going to resonate with many people, particularly Armenians. Because when you're filling out these lists, you see something like this. Now, this list might not be representative of actual diversity. If I gave this list to everybody listening to this talk, I may not accurately comprehend who my audience truly is. If I gave this list to the Armenians listening to this, and let's say everyone was Armenian, who knows how this list is going to come back? So I don't believe this encapsulates diversity effectively. One more small thing about me is I'm currently getting my MBA, and one of the business philosophies that we talk about is that bad data sets in will give you bad results coming out. And my computer analytics friends know this all too well, my statistician friends. And this concept is called garbage in, garbage out. If the information going into an input is bad, what comes out will also be bad. And so if we want to understand what diversity truly is, that list might not be the solution. But diversity is a wonderful thing that we should all be striving for. I wish I could make this a call to every ethnic and cultural group, but unfortunately I can't. And so because we're in this forum with this organization, this is my call to the Armenians that our diversity has been underestimated and it's time to discuss this. Look no further when you look at the importance of diversity than immigration, an immigrant impact on American invention. I want to put this graphic up. Stanford's Business School cited this in an article. And it shows the immigrant investors' outsized output. And I'll walk you through this. So they quote 10% of the population is immigrant. Of that 10%, what they're trying to show is that they are punching way above their weight class. Because of that 10%, 16% of inventors are immigrants. Of that 10%, the immigrant population, 23% of the patents belongs to that 10%, and 24% of the most cited patents. And despite the immigrant population being 10%, a quarter of patent market value belongs to that 10%. And this is so true from a historical standpoint as well. All the things that we use today, every day, that came from immigrant inventions. The telephone was invented by a Scot. Nikola Tesla, the other 300 patents that he had. He was Serbian. A Belgian invented the first synthetic plastic. And many people on the talk might anticipate where this is going next. And of course, it's going to go to Armenian contributions because we've made significant contributions. This is not just because we're in a forum of Armenians. This is because the contributions that Armenians have made are absolutely significant. And let's take a peek at just a few of them. You can do a whole lecture on just Armenian contributions. Simjan with the ATM. Adamian with the color television, Sarafian with automatic transmission, and Damadian with the MRI. In my line of work in orthopedic surgery, used very frequently, but invented by an Armenian. So you start to see a roadmap of innovation and Armenian contribution and things that this country uses every day, of course, the whole world. But the medical innovations don't stop at just the MRI. Pogossian invented the PET scan and was a pioneer of nuclear medicine. The founder of modern plastic surgery, Kazanjian, Harvard Medical School's first professor of plastic surgery. And Agajanian, a professor emeritus at Yale and a pioneer in neuropharmacology, some of the first research into single cell activities in neurotransmitters such as serotonin and dopamine. So significant Armenian contributions to the medical world. Yet when you look at a list from the AAMC, or you're applying to medical school, let's say, you're going to see a list like this. And I object to this list being truly representative of diversity. So when it came to me, I was very perplexed by this. How can diversity be so good, but the input to cultivate this diversity be so limited? And again, diversity is critical for all groups, all ethnic and cultural backgrounds. This is my call to the Armenians. Let's take a closer dive. What about the efforts to improve diversity in medicine? What has been done? I think there certainly has been a lot to promote diversity in medicine, particularly with underrepresented groups. Now, many of us know a program that can even start in grade school that really promotes underrepresented minorities to follow careers in the STEM fields. I think that's absolutely wonderful. Well, when you look back at 2015, when I applied to medical school, there were efforts then as well. And I'd really like to emphasize that the point of this talk is not to discuss whether these efforts were justified or not, correct or incorrect, but to just point out that there were efforts to promote diversity. So we've known that diversity is great for quite some time, and we've tried to cultivate this. So these are MCAT and GPA scores from 2013 to 2016. This is around the time I applied to medical school. Let's take that middle dark blue column here. Let's just say that's an average MCAT and an average GPA score, and it's going to tell us your percentage chance of getting accepted into medical school based on your race. So what we see here is that for the same MCAT and GPA scores, Hispanic and Black students have a higher likelihood of getting into medical school. Of course, that is to promote diversity in schools. Again, it's not to discuss whether this is justified or not, but the fact that there have been efforts to do this, and you can see this represented differently in this middle graphic cluster here, the dark blue and the Black, Hispanic, and Black students have a higher rate of matriculation for the same scores as white and Asians. But what does this imply is my question. Yes, it's great. We're trying to get more diversity, but is that really being accomplished? Because what that implies could be that white is equivalent. Everything under the umbrella of white is equivalent. And does that include Armenian? Does that include other cultures who might not themselves consider their culture as a part of the term white? Well, let me show another example about myself and my friend group. These are two of my co-chief residents in orthopedic surgery at the University of South Florida. That's myself on your left. That's and Jack Wilson on the far right. So I'm just going to compare Jack Wilson on the far right and myself on the far left. We both have similar skin complexion, but we are nothing alike. We are the best of friends, but grew up completely differently. We debate everything, but we're the best of friends. He grew up in Mobile, Alabama. I'm a first generation Armenian that grew up in Los Angeles. We are not alike, but the best of friends. I grew up with foods that he can't even pronounce, and he would laugh at that. But both perspectives are equally valid. Diversity isn't just the color of your skin, but your cultural, diverse backgrounds and perspectives, all of which should be valid. And I can tell you that Jack and I have made each other better people because of our diversity. But if you look at the previous charts, maybe someone might classify us from afar as white, all three of us. But I really object to that. I object to the fact that this list can represent true diversity just with the nature of its inputs. I think it's garbage in, garbage out. But to further understand this deeper, we have to define another term. And that term is underrepresented groups. But we have to discuss the milieu in which this discussion is taking place. Because this discussion is taking place in a country with an ugly history. And there certainly is an ugly American history that I think it's important to recognize and never forget about. Jim Crow laws that promoted segregation, not that long ago, mind you, and the Banana Republic, which exploited Central America for their labor. Just ugly things that are a part of American history. And a lot of this term underrepresented groups comes because of those decisions that were made in the past. And we can never forget those tragedies. But let's dive further into this topic, underrepresented groups. Well, okay, where do Armenians lie? Where to start? Let's start with the census. It seems like a natural point. Well, the 2020 census had 519,001 Americans that were Armenian. Well, that's not that many Armenian Americans. It could be because of the census input, who knows? But other organizations have said that this is a low number, and really the real number should be around 800,000 to 1.5 million. So let's just say 800,000 Armenians. Now, this number pales in comparison to African Americans and Mexicans, for example, which are on the order of tens of millions. And so the 800,000 becomes just a sliver in this country. But when we say underrepresented, we're talking about representation. Well, what does it mean to be represented? Now, this could go in many different ways. You can start in the political arena, and you can see that actually Hispanic and Black representation in Congress has continued to grow year over end. Uh, what you can see here in this graph is that it's actually improved. The yellow is Black and the orange is Hispanic, and that has actually grown over time, year on end. When you look at this bar graph here, it looks at Congress and the US population. So the pink is members of Congress and the percentage of which are Black or Hispanic, etc. And then the dark blue shows us the percentage of the US population. So you can see that there is some representation, let's say for Black or Hispanics, but it's still not up to the percentage of the US population. So you could consider that underrepresented still within Congress. But what about our representation in medicine? Because this is a talk about the diversity awareness culture and its importance in healthcare today and where Armenians fit. So let's talk about representation in medicine. And I'd like to really go through this graph here. This is a graph that will depict the percentage of US doctors per the percentage of US population. So the gray bar is the percentage of the US population, and of course that purple bar is the percentage of US doctors per that ethnic group. Well, we can see here clearly that Black and Hispanic doctors are underrepresented because the gray bar exceeds the purple bar. And particularly when you look at Hispanic doctors, you can see that their percentage of the US population is approaching 20%, yet the percentage of US doctors is under 10%. So they're clearly underrepresented. But Asians, Asian American and Pacific Islander, well, from this graph, clearly overrepresented. And there's overrepresentation for whites. And then we have this other column, which encapsulates, I guess, everything else, which is all other. And this is a head scratcher for me. What does that really mean? I don't know what to make of that. Do Armenians fall under white? Do Armenians fall under all other? It's difficult to interpret that. So let's talk about it. Let's talk about what about Armenians in medicine? What about our representation? Are we underrepresented? And I hate to inform the listeners of this talk about the next slide, but I think it's important. We don't know. We don't really know. We don't have the statistics, or at least accurate statistics. You might ask yourself, well, why? Partially, our geographical ambiguity creates some challenges. Where we're located, as you can see here on the map and a large red arrow, it creates some significant challenges because there might not be something that we can unify behind. There might not be something that we can all identify behind. We don't fit into a nice, neat category that is presented on these lists. And that doesn't enable accurate statistics, which doesn't allow us to understand our representation or leverage these statistics in any way to our advantage. So if I gave this exact list to everybody listening to this talk, some of you might put Asian, who knows? Some of you might put white. I know many Armenians who put white. Some of you listening to this talk might put another race or ethnicity. And then some of you might say, to heck with this, I'm Armenian and that's not an option here, and I just prefer not to answer. It's too much of an amalgam. We have to help define this for others. Because of the ambiguity of our geography and how we identify ourselves, these challenges have to be addressed. I refuse to believe that we don't count as a people. And when we look at a list like this, it starts to have that sort of result, particularly when all of us put something different. So when I started this talk, I really wanted to answer, should we redefine underrepresented? But as I dive deeper into the issues, I realized, can we redefine underrepresented? That's the real question. And I'd argue that without uniformity, this poses a significant challenge. So what can we do? Well, we can write some other race and write in Armenian with those letters and that spelling. That's personally what I do. And who knows, maybe this goes into a bank when it's spelled all the same way. And with organizations like the Armenian American Medical Society, we can understand the physicians that we have and have more accurate statistics. An elegant solution would be to have some sort of drop-down menu like this on all formats and platforms. But since we don't have that at this point and can't popularize that just yet, this might be the best thing that we have in order to construct some sort of statistical relevance and leverage. And you might ask yourself, well, what's the importance of doing all this? Well, understanding your representation matters. It leads to more resources, better and targeted representation, and ultimately providing better medicine through diversity. Being able to understand that Armenians can impact diversity significantly, and allowing organizations to know exactly who we are and be able to select Armenians to impart a significant contribution to their organization. So as I said, the goal is absolutely to obtain diversity. I just don't believe that this list will get us there. I think our historical input is simply invalid and not representative of achieving our desired common goal of diversity. On that note, I'd like to provide the continuing medical education keyword, sort of a pause in my talk here. In alliance with all the other talks, we all have a keyword, and this is mine, so I'll leave this up for about 15 seconds so that people can write this down. And you'll need this word for your CME credits. And that's a great segue to transition this talk. And I'd like to tell you a little bit more about my story, but my story as a microcosm of the Armenian story. And I'd like to transition into discussing why Armenians are incredible healers and incredible diverse healers, and why we should all feel empowered to contribute to diversity. And let me start with my grandmother, who really helped raise me. She's the reason why I became a physician. Her name is Ovsana, and her story to describe the diversity of Armenians is representative of many people's stories. We all come from a rich history and have lots to contribute, but this is my story. She raised me, she provided my diversity, and I'd like to share her story. When I was a kid, about 12 or 13, I would follow her to her doctor's appointments and I would translate in Armenian because her English wasn't the best. And when your grandmother isn't doing well and she means that much to you as a little kid, all you can do is try to help. And so I remember giving her a promise that one day I'll become a physician and that I'll help her or I'll help people like her. And I'm very proud that I stayed true to that promise. But to discuss her diversity even further, she was a descendant of Armenian genocide survivors. That diversity was not encapsulated by this list. She was actually born in Athens, Greece, but that diversity was not encapsulated by this list. She then moved to a Soviet controlled Armenia where she struggled to provide for her family and she watched her husband, my grandfather, be imprisoned for frivolous activities. And this is a photo of my grandfather. And sort of that diversity was not encapsulated by this list. And to add to her diversity, she then came to the United States of America without a single dime to her name in 1975 with my grandfather, and they opened up a small Greek cafe named after Joseph, my uncle. That's incredibly diverse, that journey. But that was not encapsulated by this list. My grandmother's passing my intern year of residency was one of the most challenging things I had to deal with in my life. But she's imparted plenty of wisdom on me. And one of the things she imparted is the Armenian culture heritage. And that diversity, in my opinion, cannot be lost because I think there's much to contribute to medicine. I'd like to talk about the Armenian people briefly. We have suffered a great deal in our history. For generations, for centuries, there's been suffering and persecution. On September 1st, 1939, that is when most historians say World War II started, when Germany invaded Poland. When Hitler was asked about how he'll be remembered when it came to these acts, he responded with, "After all, who remembers today the extermination of the Armenians?" That was his way of justifying it. We were forgotten people then, but I refuse to be forgotten once more. And I refuse to not be recognized once more, particularly for our diversity. I don't agree that we can't contribute to diversity. And I don't agree that this list is an accurate way of representing and obtaining that diversity. So allow me to quote William Osler, the famous physician. As I transitioned to talking about why Armenians are such great diverse healers, he said the good physician treats the disease, the great physician treats the patient who has a disease. What I've learned is that being a physician is much more than a science. Treating patients involves understanding their values, their belief systems, and their cultures. Also understanding how your culture will interact with their culture. We all have friends and family from different backgrounds in life. I'm talking about the Armenian people. We've assimilated into America seamlessly, and that's something to be proud of. This is a representation of the Armenians across the world, and we've seen all parts of the world. I think that helps us be great diverse healers. We have participated in medical innovation in a significant way. We talked about it, the MRI, the PET scan, plastic surgery, neurotransmitter research, you name it. We've also assimilated quite well in this country. And I think that that in itself is a great point to discuss why we can be diverse healers. Because as an Armenian, when I sit in front of a patient, I don't just see myself as an Armenian, I see myself as a human being that's able to connect with the fellow American next to me. So when you look at a list like this, it makes you feel like you might not be empowered to be a diverse healer as an Armenian. And that's certainly how I felt. I'd love to empower everybody listening to this talk who is Armenian and in healthcare that you have immense abilities to provide diversity to your patients, and in doing so, provide the highest level patient care. And that boils down to several reasons. We have an ancestry of innovation and contribution that we should be very, very proud of. We have roots as a diaspora all over the world. And number three, we've assimilated beautifully to this country. These are the reasons that we make great diverse healers as Armenian healthcare contributors. And so when you answer this question globally, what being Armenian means in the day and age of diversity awareness, well, let me go back to the take-home points that I started this with. It means that we have much to contribute as healers and diverse healers. It means that our impact on diversity has been underestimated. And sharing my story as a microcosm of the Armenian story is just one example of that. And of course, it might be time to redefine diversity in medicine, or at least talk about how we do this. In no way, shape, or form am I saying that I have the answers, but I think as a collective unit, we can come up with some good ones. So there are several calls to action. The first one is we have to find some way of unifying. And it could be checking some other race and writing Armenian so that we have some sort of leverage, or we can call to action someone else to look at how many people have written down Armenian. And then use organizations like this one in order to leverage that further. My second call to action, I think, is the more important one, and that is to listen to ideas and contributions from a wonderful group of people and intellectuals listening to this talk. It is my duty, I believe, to promote an inclusive, continual brainstorming environment when it comes to this topic. If we contribute as a community, we will all be better off. So I would love to hear from folks as to what their thoughts are on this. And I'd like to conclude with what really matters, which is patience. The reason why this all matters is because of patience. And diversity and increased diversity in medicine improves patient outcomes. So when I or any Armenian healthcare provider is sitting across from a patient, I want you to think of a few things. Our genes have traveled the world to be there. They've seen pain, suffering, and perseverance. They've interacted with cultures across the globe. And I refuse to let that be forgotten. And I know that I share that sentiment with my fellow Armenians listening to this. It's been a privilege to give this talk. I appreciate it, and I can't wait to hear some of the ideas that will come out of this discussion. Thank you very much.